So hopefully you grabbed your donut. Not. You should be doing a keto diet, intermittent fasting, like not. But, you know, whatever. So come on, let's go. We said that when your patient is in VFIB, they have no P wave, they have no QRS, there's no atrioventricular contractions, there's no cardiac output. We said there's never a pulse. We reviewed the fact that the patient ain't gonna be talking to you and singing all kind of Cardi B songs. They're dead, essentially, until you get your butt in there and do some things. Okay, so, you know, you walked in and this is what you're seeing, squiggly garbage on the EKG. So now that you know that, let's think about this logically. One of the things you have to do on this NCLEX exam is prioritize your EKG strips. You gotta prioritize every damn thing, you know, like who do you see first, what do you do first, all that shit. So let's just remember what I taught you a while ago. I taught you a while ago, always see in this order, VFIB first, VTAC second, PVCs, premature ventricular contractions, third, torsades, fourth, AFib, A-flutter, then SVTs. So we're right here, darling. We're right here. We got some shit going on, okay? So when you look at your materials, and remember, you can purchase this book anytime you want. You can purchase EKGs with the answers anytime you want, but you have to just come into the facility and ask for it. Now, so I just want to remind you of things we've learned already, because y'all be doing too much, like, you know, like you forget shit when I haven't been all up in your face talking to you. So I'm gonna have my son come a little bit closer so I can remind you of what the hell's going on around here. This is normal sinus rhythm. P, QRS, T. Start it over. P, yada, 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 yada. Now, that's important because peep this. I'm sorry, but where the hell is my P wave? Where is my QRS? Where is my T wave? Ain't shit going on here but squiggly Q's. If you can't see that, we got a special class for you today after the class. Okay, so you got me. You feeling me on that? Now, so let's move on, shall we? When we move on and we start thinking what happened immediately before this chaos, we probably have a patient in some serious distress. Either they just fully collapsed from a cardiac arrest, or they're having an MI, and the two are not alike. I will post a little picture, a little chart, if you will, to distinguish between the two. But if the patient is in VFib, right before that, some bullshit happened. Let me show you what kind of shit could happen to your patient. They might have been complaining about the classic chest pain. It could have been a little not so classic, like atypical, like females could have been talking about their jaw hurts. I've had them say their teeth hurts. One of my brilliant students who's been a nurse now for a while in a neighborhood ER, she saved a life because she remembered me telling her that women are very atypical. She said that her patient came in and said her bra's too tight, but she ain't got no bra on. Ooh, that's a separate class. Now, so chest pain, back pain, shortness of breath, arm pain, whatever. Your patient is probably blue, or at the very least, pale, because they're not getting any blood. What color is blood? Red. Ain't none. So you know they ain't red, flush, nothing. Don't be messing that up on a test. They're cyanotic, they're pallor, they're probably nauseous, if not outright asking to vomit. Like, can I get a trash can, please? They're dizzy, because you know that's a cardiac symptom. I taught you that dizzy and syncope are cardiac all day long, unless the woman's pregnant, then you don't care to see them first. Now, I gotta add one. I don't know if y'all know what I'm gonna add. Some of y'all know. It's one of the #1 reasons to see a patient first, but I bet you're a little behind, didn't learn it in school. Woo! Woo-hoo! We're sweating, y'all. We're pouring sweat. We're clammy. We're kind of perspiring, you know, like they say in the South. So you have a sweaty patient. Let me just say something to all the babies who learned ABCs. ABCs are cute. Airway, breathing, circulation. But sweating will get you the money. Sweating means your patient is in dire trouble. It could mean a stroke, a heart attack, a pulmonary embolism. It could mean hypoglycemia. Either way, your patient in trouble. Can we get with that? Intermittent fasting, boo. See you in a minute.